Welcome to MidLIFE Matters, where we celebrate women's wisdom and wit. I'm Georgian Lussier, your host, and I'm delighted to introduce today's guest, Susan Manganello, who is a nurse that's performed a variety of roles and is now working with a vaccine program. So welcome, Susan.
Well, thank you. I'm glad to be here.
Delighted to have you. And you're currently working for Protein Sciences.
Yes, I am.
And a key responsibility is to coordinate a community outreach program with a mobile clinic.
My key responsibility is to get access points for vaccine programs.
Okay.
So one of those initiatives for access points is how can we serve the community? And so we developed a collaboration with the mobile clinic.
I think flu season's coming up.
Yes, it is.
And how does the flu differ from a bad cold? What are some of the consequences if a flu kind of gets ahead of you?
People sometimes, when you think about flu, they don't think about how serious it is. But you can have thousands of people die from the flu. It especially hits the elderly population, those that are immunocompromised. So you look at children, pregnant women, people who are diabetics, especially respiratory problems and cardiac disease. So when you wind up getting the flu, if you had a cold, it's a sneeze, it's minor aches and pains, but a flu can put you into the hospital, and you could be there for quite a while. And like I said, we have had a lot of deaths around flu. So what we try to do is educate people that you can prevent it by getting vaccinated. And you can also prevent someone else from getting it by getting vaccinated, because you can be healthy, but your grandmother or your child or your grandchildren, you can give it to them just because you're carrying it and you don't even realize it. So we talk about the herd immunity. That's how you keep those things prevented, is by getting the flu vaccine.
Tell us about this innovative 5-part community outreach program. That's buses involved.
Oh yeah, well this
right?
is very exciting. What we
Okay.
did in January, when we heard about the poor effectiveness of the vaccine, and we still had some product left over, we partnered with Hunter's Ambulance to say, hey, let's take it on the road and let's offer it to people, and we'll just give it for free. So that's what we did. So Hunter's Ambulance and Protein Science went out on the road. We would have people call us, or we'd go to the housing authorities and go to different areas where people really didn't have access to flu block. And we did quite well. I think we probably serviced maybe about 400 vaccines, which was a lot for that time of season, because we're in January, February, March, so it's at the tail end of the season. So we decided to continue that project and really create it and make it live. And so how can we give access and still, figure out payment and figure out all the different collaborations that we can do. So Hunter's Ambulance has a bus that they are going to make it like a full-blown clinic. It can probably seat about 3 or 4. It's going to have a tabletop where people go in and do their paperwork. We're going to have privacy screens. The exciting part is going to have Wi-Fi, and we're actually going to have a TV screen, so we can talk about the different collaborations and different services you can get out in the community. To take care of the billing piece, Hartford Healthcare at Home has joined alliance with us, so they're helping us with the clinic. Hancock Pharmacy, so that we can service those people in the housing authorities and those that are less fortunate, that don't have appropriate insurances or are on state assistance. Also, Spanish community, and doing a big Spanish outreach between Hunter's Ambulance, Hancock Pharmacy, and then we have Hartford Healthcare at Home, and we have a physician, Dr. Tom Knox, who has agreed to be our signing physician, and then Protein Sciences. So it's a great community collaboration that we're all in it just to give the community access to the pure choice, the great vaccine. We're very excited about it, and we're going to take it on the road, and whoever wants to get the vaccine, here we are.
And the benefits to the community are, just to be clear, so people will have more ease of access because you'll be coming kind of to them, right?
Yeah.
Maybe where they live, or an organization like SCOW that they would belong to, right, would sponsor a day.
Yep.
In terms of the financial part of it,
Well, we're going to be taking insurances, which is why, we're very thankful to Hancock Pharmacy, because Hancock Pharmacy can take care of the Medicaid component. Hartford Healthcare at Home is very generous that they can't bill Medicaid, but they will offer free vaccine for those that absolutely have no insurance. So between all the collaborations, we're going to make sure that everybody gets service. We don't want to leave anybody unturned.